Are you suffering with pain in the neck and not sure exactly what's causing it? I mean, literally, do you have a pain in the neck and you're trying to figure out what's going on, what the problem is, and what you can do about this problem? Well, then today's video is for you because today we're going to be discussing the different causes of pain in the neck and some ideas of what you can do to treat it. Now, we're going to cover the different causes today and some general ideas for treatment, but follow along on this channel because there's also going to be some videos that will show you more specifically what you can do based on what the problem is. So today we're going to talk about the different problems so you know what it is and some general treatment ideas, but we'll have some specific videos for each of these following. So keep an eye on the channel because they'll be coming soon. Many people are affected by neck pain and they notice that it's difficult. It could be difficult to hold your head up correctly, like while you're trying to do computer work or while you're looking down and cooking a meal. It could be difficult while you're washing dishes or even when you're sitting and watching TV at night. Or you may struggle to be able to check your blind spot while you're driving. And a lot of people have problems with neck pain or a limitation in neck motion that's preventing them from what they want to be able to do in their life or causing some excess motion somewhere else. So if you're having a hard time checking your blind spot or looking behind you when you're trying to back up, instead of just being able to turn your neck to look behind you, you're going to have to turn your whole upper body. And that's a reasonable compensation for right now, because obviously you want to check and make sure you don't run into somebody. But it's not great in the long term because it can put some abnormal stress on different areas of your body. And when that happens over time, it can start wearing down and cause other problems. So now your pain in your neck becomes your pain in your upper back, or your pain in your shoulders, or your pain in your lower back, or whatever. And we don't want to see that happen. So we want to figure out exactly what's going on with that neck pain and what's causing it so you know how to treat it, right? Every tissue in your body is designed to be able to heal itself. So if your neck pain is not resolving on its own, it needs some help because it's not moving correctly. If it's not moving correctly, then it can't heal. So if you're still struggling with this neck pain and it's been a while, then you want to make sure to know what's going on and what you can do about it. Ready? There are three main causes of neck pain that we're going to discuss today. Number one is the joint. So it could be that the joints in your neck are squishing down on each other, or getting irritated, not moving correctly, getting stuck, and that's what's causing your pain. Number two is the muscles. It could be that the muscles are getting really tight and strained and it's making it difficult to move. If they can't move correctly, then they can't heal, and that's what's causing the pain. The third one is the disc. All of our vertebrae have discs in between them, and when they get ruptured or herniated or even pinched, it can cause pain. So we're going to discuss all of those and what you need to do about them. First off, we're going to discuss the joint. So if you're having joint pain, what's going to happen usually is that when you're trying to perform a motion, you're just going to feel a hard stop. So I often see this with people trying to rotate, that they're trying to turn their head from side to side, and it can be one side or both sides, and they say, I just can't move any further. And when I ask them, why does it feel painful? It's not necessarily painful, although it can be, but it's the fact that it just doesn't move. They just can't turn their head. That's all there is to it. So a lot of times when people have a joint problem, it's not necessarily pain. It's more that limitation of motion that they notice, at least initially. Now, when they come, by the time they make it into my clinic, they may also be having pain. So they may say, well, it just got really stiff, but now that it's not moving correctly, it's also becoming very tight in that area, and now it's actually starting to become painful. So if you have a limitation of motion that you just feel like it just like stuck, it's like bone on bone, it just feels like I'm up against a wall, I can't move it anymore. That's what people tell me primarily when there's a joint issue. Now, inside the joint you have the cartilage, which is kind of that spongy type of tissue in there that allows everything to move correctly. So the cartilage kind of smooths out the joints so the bones aren't rubbing on each other. Now, if your cartilage is affected, that's still considered a joint problem because the cartilage is within the joint, but those will usually be painful. And that's usually when you're kind of compressing down. So if you're doing like a side bending and it feels limited, and then also you get that sharp pain in a very localized position. Usually people can put one finger on cartilage pain, at least when it starts. And they point to it and they say, oh, it hurts right there when I do that. Then that's probably a cartilage problem. We still consider it part of the joint because the cartilage is within the joint, and the cartilage becomes a problem because the joint's not moving correctly. So it's still considered a joint problem, but it is a little bit of a different tissue. And that's important because when we go to heal it, cartilage needs different stimulus than the joint in order to be able to heal. So it's really important to know exactly which one we're dealing with. Now, if you have primarily muscle pain, or at least if that's how everything started, usually people will kind of have a general achy sensation that they feel like they want to stretch it out. So maybe they have that limitation of motion, but it's more at kind of that end range. They're like, oh, I feel like I can't, it just feels really tight here. I feel like I can't go any further because it feels really tight here. As opposed to when it was a joint, they feel like, oh, it's like, that's it. That's all I've got. I can't move anymore. Muscle people are like, oh, it feels really tight. I just feel like I can't, I just want to stretch it out. And often that is the case, that the muscles get really, really tight and you just can't stretch it out with a normal way. So that's what a lot of people talk about when it is a muscle problem. Now, if you're having a muscle problem, particularly in the neck, I encourage you to consider, how am I breathing? Many people today, because of everything going on in our society, are doing this upper costal breathing, is what we call this. It's where you're using your muscles up in here, the muscles of the neck, to allow for those deep breaths, instead of using the big diaphragm, which is further down, which is actually designed to do that breathing. When you use those upper costals all the time, they're meant to be used some of the time. So they're meant to be used like, I see a bear, ooh, I'm trying to run away from the bear, I need to use those upper costals, fight or flight. But if you're using them regularly, they get overused and they get tired and stressed and tight. So that can actually be what's causing the problem. It may be that there's nothing wrong with your neck. It could be just how you're breathing. So then you want to work on that deep breathing. You want to get those abdominals really working so that that diaphragm can expand and contract, which will take tension off of those upper neck muscles. If you feel like there's no particular injury or reason why this thing started, then I definitely encourage you to try some deep breathing. We've got some videos here that we can link in the description box below so that you can work on your deep breathing in order to be able to relax the muscles in the neck. Now, some people know that they had a neck strain. Actually, I had a patient in here recently. He's like, I strained my neck. I was like, what happened? He's like, I turned over in bed. You know what? That happens sometimes too, but he was aware of like, okay, it was when I did this that I strained my neck. But if you don't have anything like that, then I encourage you to try those deep breathing exercises and see if that helps to decrease the tone in your neck. But that muscle pain will be more kind of that achy general, kind of, people kind of, brush the side of their neck or maybe the front or maybe the back, but it's not so much the finger point that we see with the joint. Now, if your pain is due to a disc issue, most commonly people will complain about numbness or tingling further down in their shoulder, elbow, or hand and wrist. So the discs are located very close to the nerve roots. So the nerve roots come out from the spinal cord, so they're very closely located to those discs. And people will report numbness and tingling down into their, potentially down all the way down into their hand, that comes from that disc problem. The other thing that people with disc problems report, and I'm talking about a disc herniation, disc rupture, or something like that, is they report that their neck feels unstable. So it's not necessarily that they lack motion, it's that they feel like, ooh, I'm concerned about doing that motion. So when they're in the clinic and I'm asking them to do different motions, bending forward, looking up, they'll bend forward and they'll be like, ugh, I just don't want to go further. And I'll ask them, do you have pain? And they're like, ugh, I just don't feel like it's a good idea. So that's more of an instability, which is what happens when that disc ruptures or herniates, is that the integrity of the disc is decreased, and so it causes everything to feel a little loosey-goosey. So people will have limitations in motion, not necessarily because of pain, but because they just feel like, I don't feel like I should do that. I feel like I don't feel safe with that. Or sometimes even they'll kind of, when they're looking down, they'll kind of use their hands to bring their forehead back up because they just feel like it just doesn't feel really stable. But often if it's a disc issue, they'll start to notice some numbness and tingling. It usually starts up in the shoulder. It will travel down to the hand if you don't deal with it soon enough. And we definitely want to deal with it before it gets into the hand. Now, for some people, it starts in the hand. As soon as that disc goes, they start getting symptoms in their hand. So if that's you, that's okay. That happens sometimes. But for many people with disc issues, it starts in the shoulder and transitions down to the hand. Now, word of caution here, friends, I have had many patients who have come in, and when I ask them when this problem started for them, they're like, well, I've been having some numbness and tingling in my shoulder for probably 3 or 4 months, but it just went down to my hand last week, let's say. If you're starting to notice numbness and tingling in your shoulder when you move your neck, you want to get specialist help right away, because it's way easier to deal with when it's closer to the source than when it's all the way down in the hand. It takes less time, there's less repair that needs to be done, and it's a much simpler process when we are just having the symptoms in the neck and shoulder as opposed to when they're in the hand. So I definitely encourage you to seek help from a specialist now if you're having any numbness and tingling in the neck or shoulder, because as things progress, it will go down into the hand potentially and cause bigger problems, and that's not what we want for you. Okay, now you should have an idea if your issue is primarily joint, muscle, or disc. And you may have more than one, but I want you to think about, where did it start? Did it start with kind of a pinpoint pain that was really specific? Did it start with kind of like an achy feeling like you wanted to stretch type of pain? Or did it start with, when I moved my head, I had some numbness and tingling in my shoulder or even down into my hand? Now, once one starts, everybody else will come on board shortly. So if you're a little confused and you're like, I have all of those things, then all of these things will be applicable for you. But try to think about where it started, because where the pain started will be the most efficient use of your time right now to help it move along. So if your pain started as a joint problem, what you want to do is mobilize that joint. You want to get things moving correctly so that that joint can heal. Again, movement is life, and every tissue in your body is designed to be able to heal itself as long as it's moving correctly. So getting that joint moving is really critical to getting everything healing. If it's a muscle problem that is your primary issue, you want to be able to stretch that muscle efficiently. What happens particularly in the neck and shoulders is everything gets really tight, and when it gets tight, it gets short. And some people will say that the muscles get weak when they're short. I don't think that that's always true. I think that they can be tight but still really strong. However, if they never relax, they get tense and they just hold on to that tension, and then everything kind of sticks in those areas. So you want to be stretching your neck in the most efficient way possible so that you can decrease that muscle tension, which will decrease your pain. And if you have a disc issue, you need the proper stimulus to be able to heal it. Now, discs respond really well to rotation. And the reason why is because the fibers kind of It's kind of like a Chinese finger lock where the fibers kind of are diagonal on each other and they're kind of lined up on top of each other. So what they like to do is they like to rotate. But the key thing is you can only rotate in the motion that's pain-free. So you have to stay within the pain-free motion so that the muscles don't contract. Because if the muscles contract and squish that disc, it's going to make your situations worse. We don't want the muscles getting too tight. They get too tight when they feel pain. What you want to do is rotate to one side as far as you can, pain-free, and then the other side as far as you can, pain-free. Keeping that motion in the pain-free range will help to provide the proper stimulus for that disc to heal without causing any further injury. You should definitely notice a difference in your ability to move your head if you're doing the rotation regularly. We will be discussing more of these treatments and more of these specific techniques in later videos, so definitely make sure you click back here, subscribe to our channel so you know when they come out, and we will see you soon. Have a great day.